Hello, my name's Helen Williams and I'm a consultant pharmacist specialising in cardiovascular disease, working with UCLPartners. I'm going to talk to you today about our proactive care frameworks, focusing particularly on hypertension and the resources that we have developed to support general practice, in particular primary care, recover from the COVID-19 pandemic and deliver care in a different way. So the UCLP proactive care frameworks consist of a number of components. First of all, there are search tools which will allow GPs to identify cohorts of patients that may need intervention, and these work on both EMIS and System 1. Secondly, we've developed pathways that prioritise patients for follow-up, support the delivery of care remotely where that's appropriate, and also identify how we can make better use of the wider workforce, such as our healthcare assistants and other link workers. We've developed scripts and protocols to support healthcare assistants and other link workers as they have discussions and consultations with patients. And there are other elements, including training for staff to deliver education, self-management support and brief interventions. Digital and other resources are highlighted that might help to support remote care and also patient self-care, and project management support, including local clinical leadership. So if we think of hypertension, we know what needs to be done in hypertension. We know what we're aiming to deliver. The UCLP proactive care frameworks focus on how we can do that and how that we can do that differently, utilising all the skills of our wider workforce. So I said I'd focus on hypertension, and this is the overarching pathway for our patients with high blood pressure. The searches that run on the GP system will identify patients on the hypertension register, the whole register, and fit them into one of these 4 priority groups. The first 3 are those patients who have high blood pressure. So blood pressure above 140/90 if they're under 80, or 150/90 if they're over 80. Priority 1 being those with the highest blood pressures, working down to priority 3 and taking into account other things like cardiovascular risk factors, comorbidities and ethnicity. Priority 4, which actually makes up a big chunk of patients in most practices, are those patients who were well controlled when their last blood pressure reading was taken. So once initially prioritised, the aim is to get a blood pressure reading off the patient, ideally from home. That might mean they move into different priority groups depending on that reading. But those that are well controlled, usually making up half the population, can be initially reviewed by a healthcare assistant or other link worker role, focusing on self-management, behaviour change support, ensuring they don't have problems with their medicines. They might need to flag the patient for a review by the pharmacist if there are issues identified, support patients in submitting home blood pressure readings, advising them when to do so and when to seek help based on the blood pressure readings, and identifying any red flags that might need referral. This means that the prescribing clinicians, nurse, pharmacist, GP, can focus on the groups that are higher priority based on their blood pressure. So priority 1, very high blood pressure, needs pretty urgent intervention, and then working through those priority groups. Most of these patients will need a prescribing intervention as well as all the behaviour change support. The clinicians can focus on the medical intervention and still be supported by the HCA or other link worker to provide self-management and behaviour change support. An example of this type of approach at a borough level, running these sorts of searches for hypertension, you can see in this borough a 446,000 patient population, 40,000 with hypertension. Of that cohort with those 40,000 patients, only a very small number in that very high priority group, less than 1%. And then as we move down the priorities, the numbers do get bigger, but priority 1 and priority 2 together are around 18% of this population. And over half, 52%, are in the lower priority group that don't require urgent intervention from a prescribing clinician, which reduces the workload for them to focus on. You can see that if we focus just on those 18% higher priority cohort and optimise their blood pressure management, we can prevent up to 71 heart attacks and 106 strokes over a 5-year period for this population. The pack also contains resources on how to get a home blood pressure monitor, whether it's from the patient's own device. 30 to 40% of patients have access to a blood pressure monitor at home already, whether it's through a scheme locally or nationally, like the Blood Pressure at Home programme, which is currently distributing blood pressure devices to patients with poorly controlled blood pressure. These patients need support with their education, but that doesn't need to be all delivered immediately. And you'll need some form of digital tool, as the numbers of patients doing this increase, a digital tool to allow the transfer of data from the patient to the GP practice. Important to recognise the wider cardiovascular risk for people with a high blood pressure, and that lipid management is also part of that package if they have raised Q-risk scores. And within the pack, we've got resources on optimizing lipid management with statins, if they can't take statins, with ezetimibe. We include lots of resources for patients, signposting to existing resources on the British Heart Foundation and Blood Pressure UK website, videos, how to take your blood pressure accurately at home. You can see there also a video about what is AF, why is it important to me, and pulse checks, how to take a pulse to assess for irregular heart rhythm. Also resources for behaviour change. So the 1U programme that looks at smoking cessation, physical activity and diet. And also flagged in all of our packages is mental well-being. So focusing on ensuring that we are assessing patients' mental health and supporting them with the resources to support their mental health. Also, signposting to remote management tools that may or may not be available in your local area. For example, blood pressure devices. How do I know which device to buy? Ensuring it's a validated machine. At the bottom, you can see the AliveCore device, which attaches to a smartphone through Bluetooth and will record a single lead ECG for detection of possible AF. At the top right, the FibriCheck device, which analyzes pulse waves in the finger to identify irregular heart rhythm. And at the bottom, the Healthy IO, which is a smartphone app coupled with a device that allows you to check for protein in the urine. So this is a very brief introduction to the frameworks that have been designed really to support primary care transformation in the way that we work to manage patients with long-term conditions. More information, more resources, more support can be found at the website address on this slide. Thank you for your attention.